Right. Good afternoon, everyone. I'm Ignatius Jean, the Executive Director at the Caribbean Water and Sewage Association. And we are bringing you CAWASA Wednesday webinar. This is number 2 of 2025. And the topic today is approaches to dealing with water quality and health challenges ahead. And this will be presented by our distinguished guest, Dr. S.K. Weragoda. And he is up in this early morning hour in Sri Lanka presenting to us. And then I will just tell you a little bit about our very distinguished presenter. He is an eminent practitioner and scientist in water and wastewater treatment, serving as the director of the Joint Research and Demonstration Center for Water Technology, JRDC, under the Ministry of Water Supply in Sri Lanka. He also leads the Water Safety Plan Advisory Unit of the National Water Supply and Drainage Board, a role that underscores his expertise in advancing water safety and sustainability. He is a chartered engineer accredited under the Washington and Sydney Accords through the Institution of Engineers, Sri Lanka, IESL. And Dr. Weragoda brings over 20 years of comprehensive experience in the design, construction, commissioning, and operation of water treatment facilities. He is also internationally recognized by the World Health Organization as a regional authority on water safety planning, implementation, and auditing. He has forged collaborations with leading researchers and institutions across the globe. His scholarly contributions are extensive, with over 130 research publications, an impressive H index of 16.
Oh dear, this isn't working at all.
So, ladies and gentlemen, I have quite a few pages of his career achievements, but I will be very brief with this and invite Dr. Weragoda to lead, to take the floor. Over to you and welcome.
Thank you so much. And it's really exciting for me to address this gathering today here. And very especially a country like Sri Lanka. And when it's coming Caribbean, I know that you all having almost like similar context and experiences. It could be very, interesting for all of us to share these thoughts, views, and whatever the struggles that's coming for water. So leaving that in mind, I thought of taking you around for almost like maybe 45 minutes.
I'm coming in now.
And I got 50 slides for the day. And the topic is given as, I said,
I'm going to keep an eye on it, but I'll turn the sound down.
yes, thank you.
Oh, comes with Fernando. And
Yes, thank you so much. Yeah. So the topic is given as water quality and human health challenges ahead. So this is the first slide I just picked today. It is about the beauty of water. When you see this very recently published news coming from Manchester Institute of Technology, USA, telling that how light can vaporize water without the N4 heat. This is one interesting photomolecular effect of water. And I got very much wanted to see this because it was published 2024. Without heat, how you can bring up this vaporization, something from gas, liquid phase. So that's what I want to tell you. That's what I want to highlight you. Water is a sort of mystery for us. It's just 2024 April only we are discovering that water can be vaporized, not only because of heat itself, but photomolecular effect. So 10 years back around, people were talking about water has a memory and a lot of stories. So what is a wonderful, beautiful sort of commodity for us, but still what we know about what is a huge question. That is why these challenges are still remaining as something for us to go and resolve. So thank you, Kawasa, for inviting me. And I am from the other part of the world. So it's Sri Lanka, where right now I am sitting here, and you all are there in Caribbean. That's almost like other part, as I said. So, I mean, then Sri Lanka is a country with 65,000 square kilometers, and we are having 9 provinces and if you find Sri Lanka is coming as one of the most preferred destinations in the world for tourism right now itself, that because of the natural beauty, a lot of other ancient structures, and one famous is Lion Rock. So I would be happy to welcome you all if you find a chance to visit Sri Lanka. So it's a nice transit point as well if you are going to Australia or any other part of the world. So that here we are. Yeah. Okay. So keeping that aside, let me take you to the content. So I'll be just having an introduction, then challenges from water pollution, details on water and sanitation sectors, impact from climate change. So Sri Lanka was ranked as second most affected country in the world in 2018 by looking into the losses that we found, devastating impacts that coming from the climate change. Then as well, then we were ranked as sixth most affected country in the world in 2019. That because of the long-lasting issues that we were facing for decades and almost like a decade now. Then I would just talk about the treatment technologies for water and sanitation, then management approaches. So I thought of putting up this content page as that because, as I said, so Sri Lanka is an island country in the Indian Ocean, and we are in the latitudes of 7 plus, and I found that Caribbean islands also come in almost closer to that. So our experiences could be something worth for share common problems. So that is the main idea of putting up this content. So introduction, of course, I just thought of taking you into this particular slide, which says what the beginning of this science, especially this modern medicine. So it says the book, which is still the author is unknown, done somewhere long ago, 2,500 years back, telling that air, water, and places, that means soil, will be the critical dominating factor about your health. On the other hand, it's a nice sort of what I would like to put up here that says us what is poison. Anything beyond what we need is poison. So that's done by a sort of tribute leader. So then picking up that two chords, I would like to come back to science. So what is the major component of our body? It's like for the men, it's about 60% body weight represented by water. For ladies, it's about 55% of the body weight. Why water is so significant for us? Because it's making all the way of our lives. When it's coming for blood, it's about 85%. Brain again back 85%. It's a huge sort of representation. So without water, no lives. That is why NASA is all the way going behind planets with water for identifying creatures. So if you don't find enough water, you will see immediately in your skin and headaches, and especially your brain, and then you are in difficult situation in regulating your body temperature. So then digestion and many other. So we have to have a sort of like a proper consumption. So our daily consumption remain as like if you just get your body weight in kilograms, just divide by 39, that's the minimum requirement of water per person per day. In addition to that, if you are there in an outside environment, then you have to consume the additional water that is getting as sweating and breathing and all. Because a person per day is about 400 milliliter of water being lost through breathing as well as sweating and urine. The medical doctors all the way ask us to make sure whether we are having enough water to ensure that 1 milliliter of urination like in that rate. So that is what the medical doctors. If you go to Germany, Germany would raise you, telling that, okay, if your water color is same as your urine color, you are having enough water. So that's norms that we are keeping in mind all the way. This slide says us how what is important to us. So then it's about Sri Lanka. Do you find access to safe drinking water across the country, that is Sri Lanka? So there were a lot of articles and people all the way raising up, especially the academia. So this is one of the vice chancellors in national universities. So he was raising all the way 2 years back, and the honorable minister by that time just called me and asked whether this is a really truth. Of course, yeah, we have almost like 50% of the population depending on the surface water, and another equal amount, equal number depending on the groundwater. And Sri Lanka having 21 million of total population. So it's coming like about almost like 10 million plus something. So then how we are going to handle this? So if I just see the situation in the country, in addition to whatever the natural pollution, we have a lot of impacts coming to the man-made solutions, man-made issues as well. Like I'm in the one of the main cities where that we are getting water into capital. So once it was an accident where that Coca-Cola had almost like got a lot of oil into river, where that we are having 400,000 people fed through this particular river water. So that is one particular incident. So urbanization, improper planning, these are making a lot of troubles because you don't find septic tanks there because you don't find space to put up septic tanks. So might be some of the rivers getting directly this sewage back into water. Then the country is struggling with solid waste management. Most of the cases we have open dumping and we don't find proper approaches as that. So then finally leach and all getting into this in the water bodies. So these all are challenges. Okay, so then you might got a sort of an idea. So then the second part of my presentation, I'll be just taking you into the challenges that we see in terms of water pollution. I thought of putting up these two slides where that I did my PhD. So that's Japan. So Minamata disease, it was something you know well, and one other that we call as Itai disease. So Minamata disease is because of the in the Minamata Bay, because of the consumption of mercury through the bioaccumulation. That's because they didn't know what exactly happening by that time. So then we have videos, you can get into YouTube and see how the people were struggling, suffering. So same like Minamata, we had another issue called Itai disease. In Japanese language, Itai means is something that unbearable pain because your bones got replaced. That means the calcium got replaced with cadmium and bones become as brittle like glass. So then people terribly suffered for this particular two diseases. So that made us sort of like eye-opening for whole world to think of. So then we are getting back to Sri Lanka. Yes. So this is what the fluoride map for us, and this is what the hardness map for us. So this is where Colombo. I am from Kandy here. So this part of the country is the wet zone where we are depending mainly on the surface water. So our average rainfall is about 2000, maximum is about 5000 plus millimeters per year. So whatever the dry zone, that's all the way this part, you see that the fluoride concentrations are high. Then we do see dental fluorosis as coming as one of the very common issue. So far, we are lucky we don't find skeleton fluorosis, but dental fluorosis is a very common factor, common scenario that you would observe here. Then the hardness, again, back you see, it's coming as almost like high hard water. So it's very clear that the white color zone is one that we are having the wet zone, and the other, all this pink to blue to red is coming as the dry zone. So water is hard. So we have to find solution, and most of the people they are living here are basically based on groundwater. And Sri Lanka having 2,500 years of written history, where we are one of the main countries that having 30,000 plus man-made reservoirs, tanks, that's in the medium to small scale tanks. That is where that people got water all the way this 2,000 plus history for their day-to-day consumption as well as for the irrigation. So luckily we got this. So some of the water treatment plants we located in this part are getting with the lake water, not still the groundwater, but still that is not that much of all the way 40 to 50% of the people are dependent on the groundwater. So in terms of tracer elements, so you find that we have cadmium, we have chromium, we have many other, but when it's coming to the Sri Lankan water context, we got arsenic as something alarming for us. So this is the place where that we have the maximum amount of arsenic, that is 66 microgram per liter. The standard is 10 microgram per liter. As usually you find in many parts of the world, arsenic is getting in higher in greater concentrations in the coastal zone. That's crossing the 10 microgram per liter standards, WHO as well as our own Sri Lankan standards. So we are safe in terms of heavy metals, but when you take other elements like hardness or fluoride or somewhere cases like agrochemicals might be challenging factor for us. And though the heavy metals are still coming as lower than the standards, but still some of the case by cases are there which were reported, like because of the ad hoc use of these industrial approaches. So those something. So these are the nitrate, as I said, like the agricultural pollution. What I said previously about the natural pollution, now it's coming back to agricultural pollution. You find that the nitrate levels are getting higher in some part of the country, especially in this area because of the sandy aquifers, where that we have sand dunes, and this part where that we have limestone. So these are the one that we are struggling with high concentration of nitrate as well. When you take up nitrate as the one standard, so it's getting as 50 as nitrate nitrogen. So then you find that the pockets are there with high nitrate. So these again back in the dry zone where that we are having groundwater consumption as getting as the major source for water supply. So these are some of the figures which I got in 2012 with Japan, and these are the information published in 1984. So you see that after almost like 30 years of time, how the intervention of this use of agrochemical made this nitrate as coming as a problem in our groundwater. So these are the couple of districts. Out of 25 districts, you find 1, 2, 3, 4, 5, 6 districts has already crossed the line of 50. That's comparing to 1984 is something devastating, and we have to be very serious on this because some part like it is the northern part of the country. The length of the country is about 450 kilometers and width is about 225 kilometers. This part, there was a sort of like a study done by the medical experts sort of correlation with nitrate, the cancer patients. So there's a sort of like positive correlation. And people thinking that as like blue baby syndrome, there could be some cases which are not officially recorded, but blue baby syndrome is one that it could be a case for us to think of. So then challenges still remain in that because we in the South Asian region, you might be knowing India, you might be knowing Pakistan, but when you take the fertilizer consumption per hectare, Sri Lanka is the leading. That because of some political reasons, couple of government has decided to get a huge subsidiary, and then people got plenty of fertilizer, and then the total consumption is almost like 3 times of the requirement, the recommendations by the agricultural experts. So that made again as we are in a big trouble to go and ensure the water safety. Okay, so this is my third part. Now we are Sri Lanka and what are the problems that we are facing. So now let me take you into the water supply, as you do in Caribbean countries. So this is what Sri Lanka. So basically, there's a government-owned single institute, not like many other countries. Sri Lanka having a one single institute to cater the water demand in the major cities. So we got 337, almost like say 340 water supply schemes across the country to address this water requirement, pipe-borne water requirement. So mainly the wet zone, they are basically based on the river water, and dry zone, they are based on the lake water, and some cases they are based on the groundwater as well. So our largest aquifer is here, where that we are pumping 10,000 cubic meter per day. And the largest water treatment plant from the surface water in Colombo, the capital city, is almost 500,000. So our water production through the national body is almost about 2.8 million cubic meters per day. So then still we have a deficit of 2 million to cater the 100% population if we want to meet the SDGs. So this is the challenge. This is where that you find the population covered in blue color spots. So when you take up this area, it's almost like most of the parties come in as agricultural areas because Sri Lanka is an agricultural country. And our forest coverage is about almost 21% of the total area. So when you take up like the whole country, we were having a plan to meet the 100% cover, 100% safe water access by 2025 previously, but now it has been lifted to 2030. So if you want to make the 100% access as per the SDG 6.1, we have to bring it back into this. So it's a huge challenge in front of us because we have to find almost like 100 plus billions of US dollars, that plus something is there remaining as challenges. So in nutshell, this is the water sector figures in Sri Lanka. As I said, so then we have total households coming in 2020 as 5.7 million. And we got the National Water Supply and Drainage Board. That is the government entity for drinking water supply in the country, where we could cover 40% by that time, giving 2.3 million connections, and commercial connections almost like 200,000. And there are small cases where that we find local authorities are having sort of control over some part of the country for water supply. That because we, as a colonial country, we got the independence in 1948. So till that, the water supply was under the local authority in most of the cases. So that is, they are still remaining as couple of like 1.2%. And then we have a sort of different arrangement. So this is a sort of like small scale, 500 to 2,000 family per unit like. So this unit is called as community-based organizations. So the communities are empowered to get water supply handled by themselves for almost like 1 million people. So it's like the connection. So you can just multiply by 4 to see the total population fed through these community-based organizations. When you take up the percentage, it's 12.5. So total in 2020, when you add this 1 and 2, it's about 43.7 that we can count as safe water access to population through pipe one. So this is what that the figures, if I just take up here, and what that we are anticipating by 2030 is to bring this figure into 75%, and the CBO managed water supply from almost like to 25% to make it as 100% SDG. So when you take up this again back, so our currency conversion is, I just take up as $1 is almost near into 300 rupees. Rupees are the local currency. So right now, our connection charge is almost crossing per house is almost like 700,000. So you can just identify, if I want to increase this by 20% almost, how much money that we have to invest. So that is one financial challenge. If I just look into the sanitation figures in country, we have basically on-site sanitation, which is 75% and targeting 100% by 2030. Open defecation, fairly nice this is coming only in the upcountry where these tea plantations are there, and hopefully we want to reduce that by zero. So these are the figures, and when you take up the total country centralized systems, it's less than 3% still, and government want to increase that into about 10% by 2030 for the urban congested cities. But our per capita is something coming as a huge challenge that's crossed over 2.5 million per person per household, like say that's in rupees. Just divide by 300, you can understand. So country again back is being an island country. So far we are relatively having enough water, but as we are struggling with the climate change impacts, our wet zone is getting wetter and dry zone is getting drier as dry like. So that makes us to think of water footprint, because we need to understand how much that we are putting up water as for our consumption. So that is the idea of the government to get all the products marked with the water footprint right now. Okay, so in nutshell, I would like to share the figures that we designers used in getting with our water supply schemes. 2000 around, we were using 180 liters per person per day. Right now, we have dropped it down from 180 to 140. So this is our urban consumption for through the domestic water supply. So if I want to make sure to have the water, so I have to would just simply multiply by my figures by the population. So for the rural context, it's about 100 liters per person per day. So leaving that 4 liters per person per day is for drinking and cooking. And the hardest problem that what we find is still 20 to 25% of the water is being lost as non-revenue water. So in the Colombo, our pipe-borne water supplies is one of the oldest in Asia. So it's after Tokyo in Japan, we got pipe-borne water from 1819 around. That's during the colonial period. So like London in UK, so most of the pipes are old. So we got a World Bank funded project, but it's still that's to address this Colombo, but we need to go for the whole country to put down these figures. So this is what the climate change says us. So that's also as remaining as a challenge to us. So other than the producing this drinking water, other than getting the total population with fed through the pipe borne or safely managed water, then this climate change all the way impacting heavily on water quality and quantity. So these are common figures, photographs, experiences we are getting this like part of the country, and we are having scarcities. Actually, this is not from Sri Lanka, but there are some cases in Sri Lanka. So this is from India, but we do find the same situation in some part of the country. And one more is that when you have scarcity with water supply, we have the people might getting with the alternative sources which are not managed as the proposed sources. So you are in a risk of getting exposure into unsafe water. Okay, so then we understand the urbanization as well as the climate change and many other reasons how that the country is struggling to make this 100% coverage by 2030. And we got hit by the this COVID, the pandemic situation, as well as financial crisis that we were under serious financial issue in last couple of years time. So keeping that in mind, so the government is all the way trying to bring some alternative options, and we as a research team, as a government institute, we are trying to introduce a couple of new technologies as well proven in other countries, but we want to bring back and make it uh, happening in country like Sri Lanka as well. Keeping that in mind, I would like to talk about a couple of technologies that we have introduced into the country for water and wastewater. So this is groundwater treatment that's using nanofiltration plus RO is getting as sort of like hybrid system where that the reject volume has been reduced. Previously with RO, it was about 50%. Now it's been taken as down as about 25 to 30%, like that's with the combined nanofiltration and RO systems. These are for the domestic level and especially for the community level. So This type of plants are now introduced into the dry zone where the people are having these community-based organizations. Most of the community-based organizations, we got about 4,300 community-based organizations across the country to get water for almost like 2 million of the people. So these people, most of the cases, they are looking for sort of best technologies. And this is what that we have introduced with this reverse osmosis and nanofiltration, because you understand that the membrane price for nanofiltration is coming down, and we can get as almost like same as the RO membranes. And the importance of nanofiltration, your treated water TDS remain as something 50 milligram per liter. The EC is electrical conductivity remains about 70, 80, right? What we want, because people were struggling with RO because of the low TDS, about like 30 or 20 around. So that is not good for their health. And there were research publications done in a couple of countries like Saudi Arabia as well as Bangladesh, showing that just exposing yourself into low TDS water for a long time might have negative impacts in your heart. So that because 20 milligram per liter is the minimum and 40 is the maximum force in terms of sodium for you to consume through water. That is what is fine. So, okay, so that was something that we were thinking in the country to bring up a sort of like fairly managed TDS in treated water for these community-based organizations. So then this was another technology that we introduced as electrodialysis reversal technology, which is being given as one of like technologies, especially for treating, I mean, like groundwater with high salinity. Because as an island country, almost like 10 kilometers coastal belt is getting high concentration of salinity. So EDR is coming as one of the best technologies, because when you compare the seawater desalination plants, the cost per cubic meters almost remain as 1/4 of the cost coming for the seawater desalination. So when you take up the groundwater in the coastal zone, so EDR would be one of the good solution, because our experience and about 2,000 with the system having. As a sort of like a partner in from. So spontaneity concept is being used in other countries where that you have underground storage, especially for agricultural purposes. So each and every block you can like a plastic sort of container system which that having enough space for us to store water. So this is done for one of the agrarian building where the natural purpose. So these are being isolated from the water by having geomembranes. So that is what that we are doing, because otherwise this could be contaminated and water won't be nice for you to store and use in the couple of cases like. So we were looking for some other options like using this chicken bone char as a remove fluoride. So in with Japan in the rural sector introduced alternative solutions to be sort of affordable so for these people. So as with the academia, not only the practitioners who. So when you take the sanitation, so Sri Lanka as a developing country in the with a tropical climate, so thought of going with wetland systems, so subsurface wetland systems, and then anaerobic ponds, and so on. So good for us. So this is something close by Colombo we have done by our institute. And again, back we were working so much hard in the hilly areas. This is also one other experience coming from the National Water Supply and Drainage Board, which is responsible government agency for putting up these technologies. And then for the septage treatment, as I said, so 75% of the people or coming to 80% of the people having septic tanks at the as on-site treatment. So septage is coming as a matter for us. So we got with the pond system to go with treatment in addition to wetlands. So these are some of the experiences that one of the World Bank funded project got couple of experience, I mean, like pilots done for us to introduce these technologies for the urban areas. So this is a brief what that we are stabilization ponds. Then we are having aerated lagoons with maturation ponds, and then activated slash extended aeration, we call A2O process, and so in the urban cities. But all the covers less than 3% of the total population through pipeborne, and some of the waste being discharged as sea outfall in Colombo area, the all-day system. But and as a city, only one big city is been having late noise with oxidation dish system. So these are some of the tourist areas where that we have waste stabilization ponds with facultative and maturation ponds. So some of the areas where that we are having still some experiences, and they are getting a sort of beautification for our facilities as well. So swell is another concept that we are trying to manage this storm water in addition to this and wetlands, as I said. So when it's coming for especially for tourist sector, where that the hoteliers, we go with MBBR, move-in bed bioreactors, which that we have done for one of the bakery, about 25 cubic meter per day capacity, small scale. SBR system batch reactor, where that we got for one of the temple in central part of the country. So these are some demonstrative projects for people to understand foreign technologies, especially because you can cut down this point source solutions pollution. So it's going to be a good option for surface water and the groundwater. So this is what that we were introducing for the country. Again, back a sort of like experiences we got from Thailand or Singapore or Korea about the floating wetlands. And this is something putting into the reservoir lakes in the urban cities, especially where you don't find space for putting up treatment plants around the city, around the lake. So these floating wetlands are done to address the inflows coming into these lakes in the urban areas. And not only just this treatment, but sort of like awareness, because when you see these floating wetlands, people are getting vigilant and they would question why this is, and then people would understand the impact overcoming with these pollutants from there. And now my last part of the presentation, that we are trying to introduce these management approaches. So Sri Lanka, as I said, in 2000 around, we had per capita consumption coming as 180 liters per person. With introduction of saving appliances, so we could reduce that from 180 to 140 now with the urban cities, urban areas. That's one that we would see in the world, even across the world. And when it's coming to Sri Lanka, so we thought of putting up this and sort of awareness in line with this to bring down this water consumption. As well, I would like to just show one example coming from Bird Next in China, where that they have MBR system, fed water, treated water as sewage and filled with this all the tanks, and they are managing very well this landscaping with the rainwater harvesting. So this is what they are doing, and we are trying to introduce these technologies to us as well because of the project that we are closely having with Chinese Academy of Sciences. So this is another experience coming from Ethiopia, where that we are going with this canvas for sheltering, as well as they can manage to collect the atmospheric water, that is fog harvesting, for a sort of like population. So the largest fog harvesting facility in Africa is getting about 400 families fed every day like this. These are some alternative technologies we are thinking of. As well, this smart water management is one other approach that we are thinking of, especially with the smart meters, and to bring up down the water losses, especially this NRW and all. So this is another sort of management approach that the government is all the way focusing as well. So not only this management approaches as like technology, but we have to go and understand what is the real pollution level of this water in the country, not in terms of the basic, but in terms of the trace elements and in terms of the agrochemicals, especially about the pesticides and all, because Sri Lanka is struggling with one of the devastating disease called this is called chronic kidney disease due to unknown etiology. That is what it's called. So this is one of the publications which I got as a co-author, and it's also about talk about these trace elements in the total groundwater fed areas of the country. And likewise, so we are promoting and we are understanding the coastal pollution with arsenic, and then we are understanding how the groundwater get back with the organic pollutants. This is another paper which I co-authored, and talking about the organics, especially the Sri Lankan groundwater. So we were, experiencing mid, middle size organics, especially coming with Dalton 2000 to 4000, connected with this calcium and sulfate. I'm bringing up sort of like different scenario where that can make a sort of like additional stress in your kidneys. And then when you go with the long-term consumption of this groundwater with middle weight molecular these organic compounds with this inorganic and making sort of like oxidation stresses in your kidneys. This was something that we published as a sort of like hypothesis for CKDU. When I take up this CKDU, as I said, chronic kidney disease due to unknown etiology is as coming in couple of countries in the world, as tropical countries like South American couple of, as well as India and somewhere there in Asian countries also. So in Sri Lanka, the number of the patient is almost like about 50 plus thousands. So that is the prevalence is fairly high, and something has come in as a big challenge in the dry zone, especially the farming community. So we had to do a lot of research. So last 10, 15 years, Thai scientists were so much keen. And this is another study that we got done with the team from Japan. We again back, I got myself co-authored here. So that shows us the one of the insecticides. This is been very much having a positive correlation with the CKDU people. So that is something that we found and we published. So these are the things that there are a couple of teams, as I said here, myself and couple of as well as many other research team in the country going for a lot of research investigations to understand how safe groundwater with minimum treatment we can consume for drinking and cooking. So that is a challenge where that we are planning of putting up a sort of atlas for the country and so on. So then after all, the National Water Supply and Drainage Board, together with the government under the funding from the ADB, we developed 6 policies, and one policy is water safety policy. So this is published in IWA, International Water Association WSP portal. Is that you can download, and it could be a sort of useful stuff for you to understand how that we have to put up this water safety as sort of like through a policy, through legislation. So that is we are keeping as another sort of management approach. Then this is my last slide for the day. So as said, like I'm working as the director of this institute of 5,000 square meters it's at a very nice place, one of the most beautiful universities probably in the world, as University of Peradeniya in central part of the country, near the longest river in the country, that is River Mahaveli, 335 kilometers, the longest here in Sri Lanka. So this having almost like it's about 25 million US dollars worth facility, and about 4 to 5 million US dollars all the way spent for equipment, and we are having capacities for testing inorganic and organic and trying to get the service for the whole country right now through these facilities. So, we have just published this journey towards safe drinking water. And I have pioneered this water safety plan application from 2010 around to bring the exercises, experiences of this good management tool to introduce into our water supply schemes. And for the first time in South Asia, we have introduced this external formal auditing through an independent body, just following the experiences from Australia. So this brings the end of the presentation, and it's really happy for me to get you all with these experiences in Sri Lanka. I hope that these experiences would bring something additional for us to think of and bring the Sri Lankan experiences into Caribbean region to find your solutions. Thank you very much.
Thank you so much, Dr. Weragoda. I'm sure our audience would have some questions for you. I think you touched on quite a varied areas that of interest to all of us. I think you mentioned some of I, for my part, had not heard of some of that issue, some of the issues you raised. And the challenges, I think, in some of our countries where there's a lot of abstraction of groundwater and issues that would arise. So I'm now going to open the floor to um, the other participants, so they may have questions or comments. Feel free. You mentioned that there was a problem with dental fluorosis,
Yes.
and how did you manage to treat this with? Are you adding fluoride to the water in your systems? As I know in some countries they do that.
Actually, the problem in Sri Lanka is we have excessive fluoride in water.
Ah,
That is the matter.
I see.
So our standards, we were keeping 1.5 milligram per liter previously, but still we experienced, and we then thought of reducing that up to 1 milligram per liter. When you take up in the dry zone, the groundwater, some of the people were consuming directly this groundwater without treatment for fluoride. So now we are trying to introduce like reverse osmosis, which works as for us to remove fluoride as well, or some defluoridization techniques like adsorption, and a couple of other technologies are being used. So it's a matter of having excessive fluoride in water and your teeth get discolored with yellowish color patches. So that is coming as some sort of like issue for us. Yeah.
Yeah, and then there was the other problem with I think where you had it was creating a problem with some of the with kidney issues because of some other well, the other one was with no, I think it was to do with low total dissolves solids, which are not good enough for healthcare. And that is because if you have you were explaining that, so if you could just revisit that part.
Yeah, so this is something Sri Lanka is terribly struggling to find out a solution. It's created, we observed this particular disease somewhere like in 1985 around. So by that time, people thought that is something due to fluoride, excessive fluoride and hardness. And the patient count was keep on going high. And when you take the central part of the upper central part of the country, where the two districts got heavily affected from this. The number came as like 50,000 people passed away in last 20 years of time. 50,000 is a fairly big number, which is being recorded in the hospitals, but we do not know exactly the real figures. So as per WHO, CKD in adult community is about 10%, but CKDU It's not because of hypertension. It's not because of snake biting. It's not because of long run diabetics. It's due to unknown etiology. That is the challenge. So still we don't know what is the reason. Earlier we thought it could be fluoride, it could be hardness, it could be something inorganic. But now we understand the organic impact, like the dissolved organic carbon we call DOC, and especially this middle molecular weight DOC, which is because we are a tropical country with rich humus in water. So that's putting up a lot of fulvic acid, a lot of humic acid. So this might be having a sort of impact, but we know by now it's a multifactorial disease. So that is what that we understand. So we need to get proper solutions, because since you do not know the real exact reason, you are just getting with sort of like alternatives and thinking of, but groundwater at any cost, you can't drop it, because we have to rely on groundwater. 20-30% of the population, somehow they had to rely on groundwater. So we had to have proper treatment for that.
Right. Thank you, Doctor. Colleagues, do you have any questions for Dr. Weragoda? Well, we seem to have.
Hi, good day.
Yes, Timothy.
Yes, Timothy Augustus here,
Yes, go ahead.
professional operator out of Trinidad and Tobago. Interested in the constructed wetlands. I see you've been using various types, and in fact, this is the first time I'm seeing a floating constructed wetland. And it really does have a really good aesthetics if you're going to put it in a lot of these small ponds and so on. Do you have any sort of test results and so on, or from this type of system? And then what do you do in terms of harvesting if there are overgrowths of the vegetation? In terms of what do you do in terms of disposal? Do you burn it? Do you use it back into compost or something like that? Yeah.
Yeah, okay, thank you. So we publish a book called Wetlands for Tropical Weathers. It is available online, and I got a lot of publications done under myself. If you just Google Suchitra Weragoda is my name, so you can find the papers all the way available for you as well. So the thumb rule is for us to go with this type of floating wetlands to get the required treatment for a moderately polluted lake. We have to cover 1/3 of the total area. So that is one of the thumb rule that we are leaving in mind. As well, then your floating wetlands all the way, you should have to have enough uplift or buoyancy to make it as floating, as well as it should not topple. So that is one other that we are thinking of. So all these are the factors. So this is where that we got this frame done with, previously we were using bamboo, but later we got the UPVC, that because of hard to get this bamboos as you want, like in the big large scale. So one of the lakes in Colombo, capital city, we got almost like 1,000 units with this particular shape, and we were going with the cannas. So cannas is one of the terrestrial plant which is having a lot of beautiful flowers. So we find about 5-6 varieties where that you get a lot of beautiful flowers. So the second question is about what that we do with this terrestrial plant that can go for almost like 60 to 70 days of existence. Then thereafter you have to do the harvesting. So there are a couple that you can think of having some cannas or anything like typha. So they are having different uses. For us, for cannas, what we are doing is, like, as you said very correctly, we can mix it the biodegradable waste, and we can go for reuse of this as sort of like fertilizer after biodegradation. So that is what we are right now doing. And more or less, like, the most important thing is these type of floating wetlands would deliver a sort of message for the public, where that if you just do pollute your lake,
Yes.
then you are having the return back as well. Yeah, thank you. Thank you for the
Thank you.
question.
Excellent. Thank you.
Thank you. Any other questions, comments, please?
Hi, afternoon, everyone. Thanks for that great presentation. I just had a quick question on I had to step away when you were doing the SDG indicators, and I had a quick question about the access to safely managed sanitation facilities. And apologies if you covered it, but is there a further breakdown in terms of what percentage would be, I would say, on lot? And what percentage would be these have access to centralized
Yeah,
facilities?
thank you. Thank you for the question. Yeah. So the first line shows the safely managed
Yes,
decentralized
exactly.
facilities. It's
Mm-hmm.
about 75% right now in 2024, and we hope to reach it to almost like 100%. That because it's like a developing country. If you go for the centralized systems, right now the percentage is less than 3%. We are the
Okay.
lowest in South Asia even. So we hardly try to invest, but it's really hard for us to find investment because our cost is very high for household connection. So it's almost like 4 times greater than the connection cost for drinking water. And
Right.
people don't find that much of interest to get their systems connected to the centralized systems due to many reasons. So then we promote these decentralized systems through septic tanks, and only in the urban cities we are trying to get the minimum covered with these centralized systems. It could reach to maximum 6 to 7% by 2030. We won't be able to cross anything beyond that. So basically, it's a country with decentralized, basically septic tanks, and the hoteliers and all, they might be having their own system like MBBR and all, whatever that this AO processes. Yeah.
So just one, and thanks for that. And so just one quick follow-up on that. So in your
Yeah.
opinion, the on-lot systems do function adequately and provide much needed sanitation coverage for well, the remaining percentage of the population that does not have the access to decentralized.
Yeah, so that's a good
Okay.
question because we were all the way strengthening and empowering people to have proper septic systems like septic
Mm,
tanks plus soakage pits, but most of the cases still they are going with the combined systems. And some of the part of the country where that our groundwater table is almost coming as the close by line. So
right.
then the vertical diseases will not be able for us to manage during the rain period time. So we need to have minimum 2.4 meter height from
Right.
the bottom of the soakage pit to the topmost portion of the groundwater, where that you don't find that having some problems. So other than that, rest of the part is relatively doing okay for us right now.
So you'll provide guidelines for this, I'm guessing, for the
Definitely,
construction.
yeah.
Yes.
We have
Okay.
the standards and all, yeah.
Okay.
Thank you.
Thank,
Thank you very
thank you so
much.
much for that. Yeah.
Thank you.
Thank you, Lorraine, for these questions. And thank you, Dr. Weragoda. Any other questions or comments? Okay, there be none. I would like to thank you again, Dr. Weragoda, for being up in the wee hours of the morning on the other side of the globe to make this very interesting and educational presentation to us in the Caribbean. Of course, we are recording this webinar, and we certainly will be sharing it around with colleagues who may have missed it. So again, thanks to Valerie Jenkinson of Operators Without Borders for connecting us with you and that you could make this presentation to us. And also, I see that Ms. Lauren Lucky, who is the Executive Director of the Caribbean Water and Wastewater Association, that's our partner association, is on with us. So we'd like to thank her for joining this afternoon, and all the other colleagues who joined us and to listen to this very interesting presentation. Valerie, do you have any?
Well, I'd just like to thank Dr. W for being with us. And next week we have a local. So Roger Karam from WASA will be talking to us. So tune in for that one next Wednesday.
Yeah, and before I close as well, I would like to pull a plug for there's a webinar from the Nature Conservancy's Caribbean Division, the Coral Conservation Program Manager, Dr. Elizabeth Schaefer. Shiva will be hosting a webinar to introduce the wastewater awareness regional campaign launch, which is going to be on February 19th at 11 a.m. Atlantic Standard Time. That's our Eastern Caribbean time. And so I will be sharing the poster around with you. Kevin Carter, I don't know even Kevin joined us today out of Broward County, but he did share that information this morning. So I'm just alerting you. That's on the 19th at 11 a.m. Caribbean time. Thank you, Dr. Weragoda, and
Thank you so
I
much.
hope
Thank
you
you,
get back
everyone.
to bed and get some sleep.
Thank you so much. Yeah, thank you so much. Yeah,
Ignatius,
thank you so much.
Ignatius, I might add one thing. So if anybody here has a subject that they would like us to try and cover in the webinar, or you have heard a good speaker, we need, I mean, doing this every week, we need lots of speakers, and we want to make it as relevant as possible to you. So if you've heard a good speaker at a conference you're at, please let me know or let Ignatius know, and we can get in touch with them. So anything that you think might have interest, or something that you think I'd really like to hear some more information on this, please get in touch with us. This is your webinar, and we're here to make it as interesting and as educational as possible.
Thank you for that, Valerie. So I'm Ignatius, the Caribbean Water and Sewage Association, signing off and looking forward to seeing you next week. Have a good evening. Bye.